So good evening, all the aspirants present here. Today's topic is infectious diseases and tropical medicine. And the faculty that we have here is Dr. Anand Joshi, sir. He's a consultant, intensivist, and physician at Government Hospital, Hyderabad. Yes, sir, you can start. Thank you.
Good evening, everyone, and welcome to a second lecture for our series of lecture on topic of infectious disease and tropical infection. This is a part of our ongoing process from FIRST Academy for having teaching for the MRCP aspiring candidates. But I would put it in a different way that this is more of going through or brushing our basics of the medicine, and in a very interesting way, wherein we can see the different perspective, rather the practical perspective and the bedside application of all the theory which we have so far read. Now, the second topic which we are going to cover is a sepsis and septic shock. However, I was requested by the team that some of the new joinee would like to have a quick review of what we studied in our first talk. So in the first talk, we spoke about the medically relevant microbes and the antibiotic classification. We are infected by bacteria, virus, fungus, protozoals, and all other lot of microorganisms, out of which we focus this talk on the bacterial, virus, and the fungus. And all these things are classified under as microbials. So all the things which are acting against them will be antimicrobials. However, we need to differentiate that those acting against the bacterial are antibacterials, those acting against are antivirus, and those acting against fungus are antifungal. Now, this may find to be quite funny for people who are listening, but when you come into the practice and when you start giving say azithromycin or amoxicillin to all cough and cold, then that's where your application starts. So even though this looks like a stupid argument and thing to retreat it, but it is very important, I felt, that we should let people know or let the students know that antibacterial kills a bacteria, antivirus kills a virus, and not the antibacterial kills any viruses. We went through the basic structure of the bacteria. Why we need to know? Because we need to know, one is how these bacteria are going to invade us, and two, how at what point we can attack and destroy them. We spoke about how we can recognize the bacteria. We recognize the humans as a North Indians, South Indians. We go by their languages. In the similar way, we go by the color. So we in the similar way, we go by staining the bacteria, how they look like bacterial morphology, that they are round, they are rod, then how they reproduce, how they are resistant, and what food or oxygen they require. We also studied about how the bacterial virulence factors affect, and then we went through the common bacterias which, as per their classification, which infect us and cause the representative diseases. We went through gram positive, gram negative, and then the third was acid fast, and then we went through a rigid wall, thin wall, and the wall-less. Then we came up to what are antibacterials. We spoke about what are bacteriostatic, what are bactericidal, and then we spoke about and which part or the structure of the bacteria we target that makes antibacterials. And then we spoke in detail about all the antibiotics, what are the beta lactams, what are the no lactams, what are the protein synthetic inhibitors, and so on and so forth. This was a
இல்ல நான் ரொம்ப பிஸியா இருக்கேன்.
Right. This was a composite slide which I got it from internet, and we've been using it in my ICU. I love this poster which I took a big printout, and I always keep it in my ICU and in my clinic, just to give a idea about the range of organisms covered by different antibiotics. We also spoke about the drug resistance, how the drug resistance, what are the various mechanisms, why it is important. You will be seeing more and more drug resistance as you come into your practice. We spoke about different classification and what are the drugs that get resistant to these commonly occurring bacteria. Then we spoke about how we can prevent the bacterial infection in a specific situation by the use of vaccine. We also spoke about bacterial indications. Then we had a very brief overall view or classification of the viruses. This was nothing to remember about it, but to make us aware that the viruses are also classified. uh, we spoke a little bit in detail about the antivirals. We had covered HIV in the previous talk. And then we spoke a little bit on the overlapping hepatitis viruses and herpes viruses. Um, then we spoke about, as we have an antibacterial and we have the site of viruses, a site of bacteria, how they're targeted in a similar way. Viruses are very tricky organisms, so it's very hard to directly target the virus. So what we target is the interaction of this viron with our cells. So this is normal human cells, and this is how the viron enters. And then how we target these viruses from becoming ineffective. Sometimes we can kill them, sometimes we just have to make sure that they do not proliferate in our body. Then we had an overview of antiviral used in a herpes family, and then a timeline of how antivirals developed and what prophylaxis we take it. Then we spoke about fungal infection, what are the moles, specifically Aspergillus, Mucor, and then we spoke about the candidiasis. Um, Quick look on histoplasma, blastomycosis, and rest of them mainly affecting the immunosuppressed people. And then we came across these broad spectrum antifungals and their mechanism of action. We also spoke about what are the various antifungals, their classification, and a quick chart on antifungal. This is also one of my favorite posters, which I have put in, which I take a printout if I don't remember and try to refer them for a quick references. So the next one was we were supposed to talk was, which is today's topic, is sepsis, septic shock, and antibiotic adjuvant. Now, would like to know any questions from the previous talks, or anybody would like any to clarify any doubts. Anyone? No one? Right. So I'm just going to stop sharing and reshare the new topic. Is everyone able to see my slide? Everyone able to see my slide?
Yes, so the slides are visible, and also the aspirants can unmute themselves to answer the question, or they can also answer it in the chat box. Thank you.
Yeah, that would be a good one. bit of interaction is always good. So now, last topic, we found out what are the living species that interact with our body, and we classify them as bacteria, fungus, and viruses. Now, when these organisms enter into our body, the body reacts, and the manifestation of this interaction um, occurs by the way that the body will try to defend itself. Now, this is very important to understand that for thousands of years, this interaction between various organisms have been happening, and then our body also reacts by producing an inflammation. The purpose of this inflammation is, and increasing the white cell count, is to trap these organisms and kill them and throw them out of the body. Now, this has been happening for ages, for thousands and thousands of years, and has been a protective mechanism for us, because if this was not there, then our human life would have got perished, and the human development could have never gone up. Now, this interaction manifests in a different form in our body, and interaction, we call it as a sepsis. Now, as the fire or the inflammation goes up, there is also a check on that, and this check is called as anti-inflammatory effect. So there is a pro-inflammatory effect and there is an anti-inflammatory effect that keeps a check on this inflammation so that it doesn't go out of the control. And this is done by the anti-inflammatory, which will counteract the pro-inflammatory. And when the disbalance or the dysregulation occurs, the person end up in a shock-like state or a multi-organ failure-like state,
Uh,
and this we call it as a
Excuse me,
septic
sir.
shock. Yes.